Hello, everyone, and welcome to Sports Medicine. My name is Kimi Foster. My pronouns are she, her, and I'll be your host for today's panel. I'd like to begin by gratefully acknowledging that Science World is located on the traditional and unceded land of the Musqueam, Squamish, and Tsleil-Waututh nations. We'll start today with a quick introduction from our amazing group of mentors, followed by a hosted discussion. If you have any questions for the mentors, please feel free to put those in the chat at any time. Our technician today is Chelsea, who will be monitoring the chat. If you have any technical issues, they would be happy to assist you. We ask that you keep comments in the chat and questions section respectful and relevant to the topics being discussed. Now it's time to meet our mentors. Let's start by going around and doing a brief introduction before we jump into the questions. Mentors, if you could turn on your cameras, we'll bring you up on screen. Perfect. So can we get each of you to let us know your name, your job title, and the thing that you love most about your career? Stacey, do you want to go first?
Sure. So I'm Stacey. I am a kinesiologist, and I work with post-concussion clients. So those that have sustained a concussion while at work and helping them with rehabilitation, back to work and back to life. One of the things I absolutely love about this job is just helping people, helping them get back to normal and helping them live their lives to the fullest, whatever that looks like.
That's great to hear. Sylvia, how about you?
Hi, I'm Sylvia, and I'm a kinesiologist as well. More recently, I've been doing personal training. I did work in a physiotherapy clinic before, and I've switched over to personal training. And now I'm not doing as much personal training because I work for a tech startup. So this is a company that is creating a app in the health space. And the thing I love the most about my job is helping people live better lives and feel better in their bodies ultimately. So it's health is wealth, right?
Yep, absolutely. Making people feel better about their bodies. How could you get any better than that? So how did you both get started in your career, maybe? Sylvia?
Yeah, so I got my bachelor's in kinesiology. Back then, I guess it was human kinetics at UBC. I went on to be honest, my goal was to become a doctor, but that didn't work out because med school is super competitive. I went on to do my Master of Science in Kinesiology at McGill University, where I studied human motor control. So it was just learning about how we control movement, particularly balancing and reaching movements. And after that, I was looking for work, ideally in research in kinesiology, but I had a really tough time. I basically got no job offers doing research. So I got a job, did some odd jobs, restaurant industry. I worked in a call center for WorkSafe BC for a year. And after a few months, I was pretty tired of that. It was just not very fulfilling for me. So I decided I should make use of this kinesiology degree. And I didn't initially get into the field of kinesiology, working as a kinesiologist. A kinesiologist is a practitioner. We work with clients to help them use exercise to improve their lives. I didn't initially do that because I didn't feel like my degree actually prepared me for that job. So that's why I didn't apply. But then, I started talking to people I knew who worked in the field and asked them how they felt comfortable doing the job. And basically you have to do a lot of learning on your own out after school too. So I took their advice and I just applied for jobs. And eventually, you apply to enough places, you get some opportunities. And I got my first physiotherapy clinic job. And luckily I had some really good colleagues who helped me become better at my job, because to be honest, when you start a new career, you're not really good at it and there's still lots to learn. And I worked for a few years in the physiotherapy clinic. I saw that a lot of injuries could have been prevented. I worked with people with workplace injuries, usually like back injuries, shoulder injuries, those types of injuries. Saw that a lot of them actually could have been prevented if people learned to move better, if they were stronger to begin with. And I also didn't like how rehab is very reactive. You wait till somebody gets injured before you actually help them use exercise to get stronger, etc. So I decided to switch to personal training to help people become more proactive, use exercise proactively to keep their body strong. So ideally they avoid injury in the first place. So yeah, that's how I got started.
That's quite the history. It seems that you sort of pivoted all throughout your career and you used all your experiences to get you to where you are today. Stacey, what about you? The same question. How did you get started in your career?
I love what you said, Sylvia, that whole proactive rather than reactive. I definitely felt that as part of my career as well. So I got my bachelor's of kinesiology at the University of Fraser Valley. I actually volunteered for an exercise clinic that really focused on chronic disease management and fell in love with it instantly and wanted to, again, help people live better lives, focus on that proactive rather than reactive. So I worked with a lot of clients that were overweight. They had high blood pressure, they had high cholesterol, they've recently had a heart attack. So their bodies have gotten them to a state where they needed help, and exercise was the answer for them. And it was really cool to see what exercise physiology could do. So I became a clinical exercise physiologist. I did that for quite a few years. I worked with an amazing company and ended up running 2 of their locations, got more into management. So I was able to still help people live kind of better, fuller lives, but also get more into the management field. And then I actually went on to run a concussion clinic. I really got interested in the brain and the injury there and how to help with rehabilitation that way. And then I had a baby. So I went on maternity leave and I wanted to stick with concussion. So I kind of went back into the kinesiology field, working one-on-one with clients with rehabilitation post-concussion.
Wow. So it sounds like both of you had quite the journeys to get to where you are.
Yeah.
I'm curious. I know both of you have university degrees. Obviously, you need them to get into the field that you're in. What experiences do you think helped you outside of the university degrees to get to where you are? If you could pick, one, was it a job experience? Was it working customer service? Was it volunteering? If there was one thing that you could suggest to people who are watching, what is one thing other than the university degree that would help them get into the field that you're in?
I guess I'll start.
Sure.
So yeah, exactly. There's many things. So working with people is a key part of being a kinesiologist or a personal trainer. So any sort of role, whether it be volunteer or paid, where you're working with customers or clients or people in general, is going to be super helpful. So yeah, that's plenty of opportunities to do that while even starting in high school, of course. And if the goal is to work with clients as a kinesiologist or any sort of helping professional, becoming a client yourself is actually invaluable. So when I started off as a professional, I had no experience really being a client. And when I did, oh my gosh, I realized so many things. So yeah, that. And also, if the goal is to help people using exercise, which is what Stacey and I do, it's important to do those things yourself. So actually, going to the gym or doing some sort of structured exercise program yourself, because you don't want to be teaching people exercises you've never done. And the more experience you have training yourself, the better you can be at teaching that to other people and relating to other people. So actually, just being a human is important, obviously, which is, I guess, super vague, but you don't want to just have tunnel vision and only do things that are relevant for the job. You need to have a wide variety of experiences so you can relate to people.
That's a really good answer. So really, like you said, being a human. Stacey, do you have another experience, or do you want to expand on that one?
Very similar. Of course, I remember being in university and, learning about muscles and how things work, and then stepping into a gym and feeling nervous myself, stepping into a gym. So training yourself 100% is a great way to understand the human body and its response and how you feel. and the benefits, all the amazing benefits of it. But same thing, I started training just friends and family members and just getting a better understanding of what that looks like. And I found volunteering at a position that I was really interested, really changed the path as to where I wanted to go. So I think it's important to dabble and really see what else is out there, because even in university, I had no idea what a clinical exercise physiologist was at that point and became really interested in it. So I think the volunteer piece is huge as well.
Yeah, and I'll add to that in that there's kinesiologists and sports medicine practitioners. There's like so many different types of roles you can have.
Yeah.
And one of my volunteer roles was volunteering in a cardiac rehab place. It was at the hospital, and from there I learned that that's actually not what I want to do. It is very important, and at one point I did consider doing the cardiac rehab or something along those lines, but it was just I realized that teaching people resistance training was much more interesting for me, and personal training fit with that a lot more.
Awesome.
Wow. Okay. That's really incredible. That's really neat to hear what other things that you can do in order to get to where you are both today. So other than, personal human skills and working with people, what other kind of skills do you think that you might need to help you along in your career? Do you have to be organized? Do you have to do math really well in your head? Do you have to be able to do taxes? I don't know if you're going to be able to answer that easily, but I'm trying to think of, what else would help prepare people to sort of go into that field that you may not necessarily think of right off the top of your head when you say sports medicine or kinesiology. What else can help you?
I can start with that one. I think one thing that people don't always think about is that you as a human, like you say, Sylvia, you need to be empathetic and you need to be approachable. And these people are kind of putting themselves in your hands. And in order for them to feel safe, you need to have that ability to kind of come to their level and understand where someone is coming from and respect that. And you have to build trust with a client. So I think being empathetic, being open, being approachable is key to really allowing a client to trust you with their body and that movement.
Mm-hmm, mm-hmm.
Yeah, totally. Creating rapport is so key, because it doesn't matter how much technical knowledge you know and whether you're right or wrong, but if people don't trust you or feel connected with you, it's going to be very hard to help them change. So one of the key things you need to be able to do as a person who helps other people is being able to actually help people change what they do. So for example, everyone knows it's important to exercise, but not everybody does it, right? So that's going to be helping people make change and do what they need to do for whatever the goal is super important. I guess on the technical side, obviously having the relevant knowledge is important. Having an eye for movement is important. Wow. So, generally as somebody who helps people with exercise, you need to have like the eye to watch for these subtle things to know that somebody's doing it like optimally or not optimally. So that's going to be the case. So just that comes with experience partly, and just watching people move. Being organized is super important, and being able to remember details, because usually in these roles you do have several clients, so you need to be able to remember each person's specific issues and even details about their personal life, and whether they have family or whatever other things may be stressful in their lives. We need to know these things. So having being organized and having actually just paying attention to the person, those are really important skills. And I also think that with the types of roles that Stacey and I do, being exercise professionals, actually trying out different types of movement is important, because we're going to be helping people get back to the things that they love to do. And if people like playing sports and they want to get back to playing sports, it's helpful for us to understand that thing. So that's where it comes down to. Ideally, having a variety of experiences, playing a bunch of different sports. You don't have to play it for a long time, even if you just try something once. That's important. For example, I tried a couple of classes of Brazilian Jiu-Jitsu. I don't plan to ever do that, but those, 2 classes that I did helped me better help one of my current clients who does actually play that sport, because there are things that I never would have known had I not tried it. And I guess there's a lot of different things, but hopefully that's a good start.
Those are great answers, though, to those questions.
Yeah.
On a slightly different note, then, what is something that surprised you when you first started out? And that can be at the beginning of your career, that can be now, today. Other than, the pandemic, what surprised you most in your career?
Okay, I'll start. And I guess this hit me pretty hard when I was actually looking for work, it's how little my undergraduate degree actually prepared me to do the job. So a lot of what I learned was on the job and through continuing education. So there is a lot of opportunity to learn outside of the school setting. And the other thing is, unfortunately, I was one of these people who was like, I cared a lot about school, but not a lot about the soft skills. So after working for a few months in this role, I learned about the importance of people skills, which I didn't really care about before. So now that's something I think about a lot. But without people skills, you're not going to be able to be very effective as a professional that helps people. And also human behavior, what we decide to do, we don't act based on rationality, unfortunately. So understanding that is really important, because if you just try to give people logic, that's not always going to be enough. Just same thing with that exercise example. People know logically exercise is good, but people still have trouble doing it.
That's very true. Stacey, what do you think? Anything surprising?
Similar, like same, finishing my kinesiology degree didn't really prepare me for the hands-on that you need to do when it comes to being a kinesiologist. And now kind of working in this concussion field is education is so important for these clients, because they have a lot of pain, they have a lot of discomfort. And I'm used to exercise really making the body feel good. And when it comes to concussion, their brain is kind of protecting itself. So when it starts to do things more than it's used to, it starts to cause pain in different areas. And exercise, even though it is good for them and they need to be doing it and they will get better, the initial or the acute response is pain. So that kind of surprised me, because I'm so used to how exercise is so beneficial in so many ways. And it is, but for someone who's experiencing a concussion, they don't see it right away. There needs to be time, and there needs to be progression and development for them to reflect back and go, oh yeah, I'm actually getting better. But it's a different change of a field for me. So that was a bit surprising.
Yeah, that definitely sounds like it.
Mm-hmm.
So in terms of, I guess on a slightly different note, who are there people that inspired you or helped you along your way? Are there mentors that were already in the field that maybe you could suggest that, teenagers could look out for while they're looking to go into your field? Or did you really find that family was your sort of strong core support? Or anything else, friends, coworkers? So again, the question was, are there people that inspired you or helped you along your way?
Yeah, absolutely. I think it's always incredible to have a mentor or somebody to look up to aspire to. I know for myself, it was my boss at the time when I was a clinical exercise physiologist, is just to see how much she cared about people, B, just the knowledge that she had, and the analogies that she would give clients was beautiful. Just kind of putting the education that you learn in school, and then putting it in words that a client will really understand and respect. was really huge. Just the growth for a career for herself. This woman had opened her own business, and she has opened businesses across BC and Canada, and that was really inspiring for me. So I think it's always good to have somebody to look up to and someone that you can bounce ideas off of, and someone that you can continue to learn from. Uh, and of course, family. Family is huge when supporting a career and being able to even trial certain things on them. I know my mom is still a person that I coach and I work with, and we set goals, and she has an exercise program, and she'll just be my long-term client for sure. But it's good to have family and someone that you aspire to be for sure.
Definitely.
Yeah, same thing for me. The colleagues, so managers, coworkers, they were all super helpful in helping me learn at work. And ideally, if you, as a young professional, you want to find a workplace that has colleagues that you can look up to, and that will actually look after your professional development as well. So good managers, good coworkers. I had these both at the physiotherapy clinic that I worked at the cardiac rehab place that I volunteered at, and I worked at a big gym called Equinox, and I learned a lot from both the managers and my coworkers there as well. And actually, now that I think about it, we learn a lot from our clients too. So clients, obviously experience is invaluable, but when good clients give you feedback, whether it's, good or bad, it's constructive feedback to help you become better at what you do. And of course, I have had my own personal trainers, and I have weightlifting coaches. I compete in a sport of Olympic weightlifting, and with that, I've had coaches for that. So being a client myself has been so valuable, probably just as much as my education, my bachelor's degree. So yeah, those are things that you wouldn't necessarily think about. So I guess my one big advice is to, if you can afford it, become a client, whether that's being on a sports team where you have a coach, or hiring your own personal trainer, or hiring a kinesiologist.
Absolutely. Well, that actually leads us into this question that I asked our mentors before we started. I asked them to think about what advice they would give a 14-year-old who's interested in their line of work. So they've had a little while to think about it. Do you think you have a good answer now, or what do you think? What advice do you think you could give? Maybe 14-year-old you, what would you tell yourself when you were 14? To get into where you are now?
Okay, I'll start. So I think we already talked about it a lot, which is develop interpersonal skills and not just worry about book smarts. Mm-hmm. That's a mistake that I made, and learn about how to, I guess one thing, if you were really keen and you wanted to learn how to be a better professional in helping people, there's a topic called Motivational Interviewing, which is a really good starting point for learning how to help people make change. And it's not even necessarily just for work, but it's like, how do you actually, influence your friends and influence your family members to make changes in their lives, or, help them like you more, or whatever. But interpersonal skills is really important. And understanding yourself is important. Understand your own strengths and weaknesses. What are your values? What are you good at? What do you like doing? Because in order to work in the field of sports medicine, where you're helping people, you need to generally you do need to work with people, at least initially. And you need to enjoy movement. And if those don't align with you, then it doesn't really make sense to get into the field.
Stacey, what about you?
Yeah, I absolutely agree with you, Sylvia. You want to love what you do, right? You're going to be doing this for a long time, and you're going to be spending a lot of money on education. So you have to remember that it is something that you want to enjoy. You want to wake up every day and you want to enjoy it. I think the biggest thing for me was not really knowing what was out there. I loved movement. I loved exercise. I loved sports. I was really involved in that area in high school. But I'm like, how do I make this into a career? And you kind of have to see what's out there and volunteer at different places and ask your coaches and ask people in different fields and get an idea, just as you're doing now. You're inquiring about a career that interests you. So kudos to you for even logging on to this. But yeah, see what's out there, and you wanna love what you do.
Mm-hmm. Absolutely. I think, yeah, and even if you're if you think that you're a little bit too old to get into it, I would definitely encourage anybody who's watching to try it out. Volunteer somewhere if you think that it's something that you want to get into, sports medicine or kinesiology. I don't think there's any time that's too late to join. I think if you feel really strongly about it, you should find other people like they're wonderful mentors and get into the field and start moving and learning. That's really fantastic. And what then do you think, after giving all this advice and everything, what is one super cool thing that you can tell us about your job that is the big showstopper that you think, in your opinion? What is the one cool thing that you have about your individual unique job?
I mean, what comes to mind first is that moment when someone looks at you and says, like, I feel better, like I am able to do this. Or like, I've worked with clients that are like, I can pick up my grandkids and run around with them and play, and I never thought I'd be able to do that again. Or I can actually run a marathon or do something that I thought I would never be able to do. And just the stories that you hear from people and just being a small part of their journey and seeing that, just like, it makes a bad day feel so much better when you're just a small part of helping people just become better versions of themselves. It's truly an undeniable feeling.
Yeah, and to add to what Stacey said, is exercise truly is medicine. When, like, I originally wanted to
100%.
be a doctor, and exercise. Doctors, they're obviously very important, but there's so many other health professionals or other professionals in general that can help people feel better and move better and function better. And exercise it's good for so many reasons, but actually it literally is medicine. Stacey has been using it to help people recover from concussion and probably from some other conditions as well in the past. And same with me, helping people recover from low back injuries and be a better version of themselves, like better than what they thought they could be before they got injured. But I guess I'll change of direction for my answer would be technology is making things really interesting for health and fitness. So first of all, online personal training and telehealth. So using, like, I have personal training clients now that I don't see in person at all. I provide my personal training services to them online. So I learn about them. I do see them through video once in a while, but I learn about them. I learn about their goals and their conditions, and I give them an exercise program, and they log what they do through an app. And sometimes they'll send me videos of themselves doing the exercise so I can check that they're doing it properly. Mm-hmm. And we communicate online. So that's online personal training. I know in health that is online, or telehealth is also a thing. So similar idea. And there's actually opportunities for kinesiologists and personal trainers in the tech world as well. So I never thought I would be doing this, but I now work for a tech company helping with the development of an app. So for those of you who really do like tech and are excited about that, it is possible to combine that with sports medicine as well.
Wow, that's really incredible. Stacey, same question. And how do you see technology affecting or changing your career?
I mean, Sylvia, you kind of said it there. It's come a long way, especially now with COVID and not being able to see clients and doing lots of Zoom sessions. And I mean, I think we're always going to need that one-on-one kind of feeling. It's definitely different than telehealth, but we've been able to help more people across broader areas, right? Like you've been able to help people across the world. You don't have to be sitting in the same room or be in the same vicinity as someone else now these days. So technology has truly come a long way. And even like you see, you're talking about apps, and that is the programs that you can send people and the way you can personalize it these days is pretty incredible. So I don't think we're going to be overtaken by robots. Our jobs will still be needed, absolutely, but it does make your life a little bit easier and your client's life a little bit easier with the way technology is going, for sure.
It's an integral part to everything that we know now, I guess. Yeah, and it's interesting to hear how it's affected both of your careers so much, and just the day-to-day, how much it relies on it now. So I guess maybe one of the last few questions, if someone did want to start looking into going into your field, or has already sort of halfway through your degree, or has started working out and is really feeling strongly about it, where could they go to get some more resources about going into your career, going into your field? I don't remember who started first. Who would like to go first?
Neither. I can start. I mean, I don't really know where to start with that question.
Fair enough.
Yeah, just, I mean, if you're in high school, I mean, career day is huge, right? So really looking into that. I know even for myself, I did a career fair for one of the universities as an exercise professional, and just getting people interested in that field. So career fairs are there and available through high schools, through universities. So definitely looking for those. They happen a few times a year. So those are really good. Yeah, and looking into things like there's the BCAK, so British Columbia Association of Kinesiologists. So looking into a little bit more of that and what that entails, what credentials and those kind of things that you need might be a couple good places to start.
Okay, that's a really good place to start. Yeah, Sylvia, do you have anything to add?
Yeah, I would agree with trying to talk to professionals in the field, to talk to them one-to-one and find out what they enjoy and what they don't enjoy, and just learn more about the day-to-day of that profession. But probably another thing would be to become a client. Again, that's like, you really learn a lot about the job by being a client, and you get access to that person to ask questions. So either hiring a personal trainer, or if you have an injury, you can hire a kinesiologist or a physiotherapist to help with that. Or if you want to try a sport, you'll have access to a coach who is a health and fitness professional as well. The other thing is, if you do know for sure you want to work in this field, either as a kinesiologist or personal trainer or something in sports medicine, you can purchase the personal training certification material, because for personal training, you can study material and you'll learn a lot without having to invest in that bachelor's degree, and it's something you can start actually right away, even before you are old enough to get to university. You can actually learn the stuff just by going through the personal training certification material. And you can decide whether or not you actually want to get the certification or actually try it out, because you can read the books and not have to pay for the certification. But if you decide you want certification, you've got the material to study and to go for it, and to maybe practice with some friends and family.
That sounds amazing. Yeah, those sound like some really good resources for really anyone across the board to sort of look more into how to further themselves in the field if they're interested in it. And it sounds like a lot of what's really important is empathizing with people, and really people skills, as well as the technical side of things, which is really amazing. It's not something that you would necessarily think of. At least it's not something that I think of right away when I think of sports medicine, is empathizing and the people skills that come with it. So that's really interesting. I think we're getting close to time. So I think we have one last question. Now, do either of you have any burning questions or burning comments that you'd really like to say? And you can say no if you don't. That's totally fine. But do you guys have anything that you'd like to say to our audience of teenagers or anyone really who might be watching?
Well, I'll start in that if you want to have a positive impact on other people, it is a great field, whether you're, kinesiologist, personal trainer, exercise physiologist, or some other helping professional in sports medicine. It's great. One thing I actually really love doing is I love helping women realize how much they're capable of lifting. So that for me is super exciting. Rehab helps people get better, but like when somebody realizes, oh my gosh, I'm able to lift 150 pounds, or oh my gosh, I can do a push-up or a pull-up, that is, I don't know, that excites me. So I think that's pretty cool, because the nice thing about exercise is you can actually track your progress. That's the nice thing about lifting weights or doing pull-ups, is you can track your progress. It's very much, you can see that trend over time, and it's not, unclear.
For sure. Stacey?
Yeah. I mean, I agree, Sylvia. Like the reward of this job is incredible. I will say, like, you work with people a lot, and I think a lot of people think you have to be an extrovert, but you don't necessarily have to be an extrovert to be a kinesiologist or an exercise professional or whichever. You just have to love helping people, right? So you don't need to be the loudest one in the room. You can absolutely empathize and really help people understand where they're coming from and how you can help them. And kind of, as you're saying, Sylvia, like helping women be able to lift like heavy weights, like helping people find their worth, right? And helping them see that they can do things. And you're the coach or the person that's helping them realize that. And that's so rewarding. Like it's invaluable to be able to go to work every day and make a difference and love what you do. So if you have the opportunity, it's an amazing field for sure.
It definitely sounds like it. I think we're almost out of time here. I think any other questions would take a little bit too much, would take us over the time limit. So I'd like to thank you both very much for joining us today, and a huge thanks to both of you for sharing your time and experiences with all of us. And so now we'll be having a bit of a bio break and a bit of time to explore our interactive virtual booth. So you can access the booth through the exhibit hall button at the top of the page in Project Board. And the next session will start at 6 p.m. PST. So be sure to pick out where you want to go next. So thank you very much. And Chelsea is our tech. If you want to stop the live feed at any point, that would be great. And thank you all very much for watching and for being a part of this conversation. I learned a lot about it. So